Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why does my urine smell sweet? Sweet-smelling urine can be a sign of an underlying medical condition or infection. Diabetes, urinary tract infections, UTIs, liver disease, and metabolic disorders can make urine smell sweet. /r/n/r/n dehydration, very low-carb diets, vitamin supplements, and some medications can also give urine a sweet scent. /r/n/r/n in people with type 1 diabetes, sweet-smelling urine is a sign of a potentially life-threatening complication called diabetic ketoacidosis, DKA. /r/n/r/n Science Photo Library, Getty Images/r/n/r/n changes in the odor, color, and appearance of urine can happen for many reasons, and it's not necessarily a sign of a problem. However, sweet-smelling urine is almost always a sign of a medical condition. /r/n/r/n Some of these conditions will get better with treatment, but others can be fatal. If you notice your pee smells sweet, tell your healthcare provider. /r/n/r/n Fruity-smelling urine is sometimes the first sign of diabetes. High blood sugar, hyperglycemia, is common in people with undiagnosed diabetes or poorly controlled diabetes. /r/n/r/n High levels of sugar, glucose, in the urine can make it smell sweet or like fruity cereal. There are also other signs of high blood sugar, including /r/n/r/n Diabetic ketoacidosis, DKA, is a very serious, even life-threatening, condition where chemicals called ketones build up in the blood. Too many ketones make the blood too acidic. /r/n/r/n The cells of people with diabetes have a hard time receiving the glucose they need for energy. This can be because there is not enough insulin in the body, insulin resistance has developed, or there is not enough sugar in the blood, hypoglycemia. This can happen if a person takes too much insulin from insulin injections or is caused by diabetes medications. /r/n/r/n If the cells cannot access glucose, they will start to break down fat for energy. The chemicals that are made when fat is broken down are called ketones. /r/n/r/n When ketones build up, they can poison the body. This condition is called diabetic ketoacidosis or just DKA. People with both type 1 and type 2 diabetes can go into DKA, but it's more common if someone has undiagnosed or poorly controlled diabetes. /r/n/r/n DKA can come on slowly or quickly. Sometimes, DKA comes on in just a few hours, especially if a person is vomiting. /r/n/r/n Early signs of DKA include, /r/n/r/n As DKA progresses, you may experience, /r/n/r/n If DKA is not treated, a person can go into a coma or die. /r/n/r/n is considered a medical emergency. If you or someone else is showing the first signs of DKA, call 911 or go to the nearest ER. /r/n/r/n Urinary tract infections, UTIs, happen when bacteria such as E. coli get into the kidneys, ureters, bladder, and/or urethra. /r/n/r/n UTIs are common, especially in females who have a shorter urethral length and can have postmenopausal changes in the vagina. /r/n/r/n UTIs often cause urine that's foul-smelling, but they can also cause sweet-smelling urine. /r/n/r/n Other symptoms of UTIs include, /r/n/r/n Feta hepaticus is the smelly breath of people with liver disease. It's also called the breath of the dead and happens when compounds from liver damage get into the lungs. It can also make the urine smell unusual. /r/n/r/n Maple syrup urine disease, branched-chain ketoaciduria, is an inherited disorder that causes a newborn baby to be unable to process amino acids properly. /r/n/r/n maple syrup urine disease occurs in 1 in 185,000 infants worldwide. The most common and most severe form of maple syrup urine disease is the classic type. It is usually noticed shortly after birth. /r/n/r/n Other forms of the disease can show up in later infancy and childhood. Though less severe, they still require medical attention. /r/n/r/n The symptoms of maple syrup urine disease include /r/n/r/n If maple syrup urine disease is not treated, it can cause seizures, coma, and death. Talk to your pediatrician if your baby's urine smells sweet. /r/n/r/n There may also be a less serious reason your urine smells sweet. These include the following: /r/n/r/n Your healthcare provider can test your urinalysis to determine what is causing the smell. They can also do other tests, such as /r/n/r/n Sweetsmelling urine should be evaluated by a healthcare provider if it persists or occurs with any of the following symptoms: /r/n/r/n Each medical condition that can cause sweet-smelling urine has its own treatment protocol. /r/n/r/n To avoid having sweet-smelling urine, you'll need to prevent or treat the conditions that cause it. /r/n/r/n Type 1 diabetes. This autoimmune disorder cannot be prevented. It is usually diagnosed in young people but can develop at any age. People with type 1 diabetes need to take insulin throughout their lives. /r/n/r/n Type 2 diabetes. This condition usually develops later in life. The symptoms and side effects of type 2 diabetes can often be prevented by making lifestyle changes or taking medication. /r/n/r/n DKA. Managing diabetes is the first step in preventing DKA. If you get sick, such as with a cold or flu, checking and monitoring ketone levels at home using test strips can alert you to early warning signs of DKA. Avoiding exercising if your ketones and blood sugar levels are high can also help prevent DKA. If your ketone levels are high, you need to contact your healthcare provider, especially if you are also vomiting. /r/n/r/n UTIs. There are numerous ways to help prevent UTIs. /r/n/r/n Theta hepaticus. Steps that could help prevent liver damage include /r/n/r/n maple syrup urine disease. Since this is a recessive genetic disorder, parents can have genetic testing done before conception and or on the zygote/embryo/fetus after conception to check for the condition. A person will get the condition if they receive an affected gene from both parents. /r/n/r/n If both parents have one affected gene and one unaffected gene, carriers, their chances of having a child with the condition are 25% for each pregnancy. The chance of their child being a carrier is 50%, and the chance of their child not receiving an affected gene is 25%. /r/n/r/n Sweet-smelling urine can be caused by different medical conditions. Some conditions that cause sweet-smelling urine are easy to manage, but others can be life-threatening without immediate medical treatment. If your urine smells sweet, contact your healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.